Hi everyone, welcome to my channel. In this video, we are going to learn about humerus. Humerus is arm bone. It is arm bone. It is longest and strongest bone of the upper limb. Longest and strongest bone of upper limb. Parts of humerus. It has upper end, shaft, and lower end. Upper end, it has head, neck, lesser tubercle, greater tubercle, intertubercular sulcus. Upper end has head, neck, lesser tubercle, greater tubercle, intertubercular sulcus. Shaft, it is cylindrical in upper half and triangular in lower half. Lower end, it has capitulum, trochlea, three fossae, radial fossa, coronoid fossa, olecranon fossa, two epicondyles, medial epicondyle, lateral epicondyle. First, let's see about upper end. Head. It is globular. It forms one third of the sphere. It is directed medially, backwards, and upwards. It is covered by hyaline cartilage. It articulates with glenoid cavity of scapula to form shoulder joint.
Upper end of the humerus consists of head, neck, lesser tubercle, greater tubercle, and intertubercular sulcus. Head. It is globular. It forms one third of the sphere. It is covered by hyaline cartilage. It is directed upwards, backwards, and medially. It articulates with glenoid cavity of the scapula to form shoulder joint. This is glenoid cavity of the scapula. Head articulates with glenoid cavity of the scapula to form shoulder joint.
Humerus has three necks: anatomical neck, surgical neck, and morphological neck. Anatomical neck. It is the line separating head from rest of the bone. Anatomical neck separates head from rest of the bone. Surgical neck. It is a constricted portion of the shaft that lies below the upper expanded part. It is constricted portion of the shaft that lies below an upper expanded part. Relations: axillary nerve, anterior and posterior circumflex humeral vessels. Surgical neck is related to axillary nerve, anterior and posterior circumflex humeral vessels. Morphological neck. It is a line of fusion between upper epiphysis and diaphysis. Morphological neck is a fusion of upper epiphysis and diaphysis. It passes through lower part of greater and lesser tubercles. It passes through lower part of greater and lesser tubercles. It lies 0.5 centimeters above the surgical neck. Lies 0.5 centimeters above the surgical neck.
Neck. Three necks: anatomical neck, surgical neck, and morphological neck. Anatomical neck, it separates head from rest of the bone. Surgical neck, it is constricted portion of the shaft that lies below the upper expanded part. Morphological neck, it lies 0.5 centimeters above the surgical neck.
Lesser tubercle. It is an elevation on the anterior aspect of upper end. It is an elevation on anterior aspect of upper end. Attachment: subscapularis. Subscapularis inserts on lesser tubercle.
Tubercles, lesser tubercle, it is an elevation and the anterior aspect of upper end of the humerus. Subscapularis inserts on lesser tubercle.
Greater tubercle. It is a large elevation on the lateral part of upper end of the humerus. It is larger elevation. Greater tubercle is larger elevation on the lateral part of upper end of humerus. On the anterior aspect of upper end, lesser tubercle. On the lateral part of upper end, greater tubercle. Attachments: supraspinatus, infraspinatus, and teres minor. Supraspinatus, infraspinatus, and teres minor or inserted on three impressions present on upper and posterior aspects of greater tubercle.
Greater tubercle. It is an elevation present on the lateral aspect of upper end of the humerus. It has three impressions: upper, middle, and lower. On these three impressions, sit muscles are inserted. Supraspinatus, infraspinatus, and teres minor are inserted on three impressions present on upper and posterior aspects of the greater tubercle. Greater tubercle is present on lateral aspect of upper end of the humerus.
Intertubercular sulcus, also known as bicipital groove. It is a vertical groove between lesser and greater tubercles. Contains tendon of long head of biceps brachii and the synovial sheath surrounding the tendon of long head of biceps brachii. Ascending branch of anterior circumflex humeral artery. Tendon of long head of biceps brachii. Synovial sheath surrounding the tendon of long head of biceps brachii. Ascending branch of anterior circumflex humeral artery. Parts: medial lip, floor, and lateral lip. Attachments: teres major inserts on the medial lip. Latissimus dorsi inserts on the floor. Pectoralis major inserts on the lateral lip. You can see here, teres major inserts on the medial lip of bicipital groove. On the floor, latissimus dorsi inserts. On the lateral lip, pectoralis major inserts. Lady between two majors. On the medial lip, teres major. On the lateral lip, pectoralis major. On the floor, latissimus dorsi.
Bicipital groove has medial lip, lateral lip. In between the two lips, there is floor. On the medial lip, teres major inserts. On the lateral lip, pectoralis major inserts. On the floor, latissimus dorsi inserts.
Now let's see about shaft. It is cylindrical in the upper half and triangular in the lower half. It has three borders: anterior border, medial border, and lateral border. Three surfaces: anterolateral surface, anteromedial surface, and posterior surface. Anterior border, it has three parts: upper part, middle part, lower part. For medial border, two parts: upper part, lower part. Lateral border, three parts: upper part, middle part, lower part. For anterior border, upper part, middle part, lower part. Upper part, it forms lateral lip of bicipital groove. Upper part forms lateral lip of bicipital groove. Middle part forms anterior margin of deltoid tuberosity. Lower part is smooth and rounded. It ends above the radial fossa. Medial border, it extends from lesser tubercle to medial epicondyle. Upper part, lower part. Upper part forms medial lip of intertubercular sulcus. Lower part forms medial supracondylar ridge. Attachments: coracobrachialis, pronator teres, medial intermuscular septum. Coracobrachialis, it inserts on middle of medial border of shaft of humerus. Coracobrachialis inserts on middle of medial border of shaft of humerus. Pronator teres, it arises from lower one third of medial supracondylar ridge. Medial intermuscular septum, it is attached to medial supracondylar ridge. Lateral border, it extends from greater tubercle to lateral epicondyle. Medial border extends from lesser tubercle to medial epicondyle. Lateral border extends from greater tubercle to lateral epicondyle. Three parts: upper part, middle part, lower part. Upper part is indistinct. Middle part interrupted by radial groove. Lower part forms lateral supracondylar ridge. Attachments: brachioradialis, extensor carpi radialis longus, lateral intermuscular septum. Brachioradialis, it arises from upper two-third of lateral supracondylar ridge. Extensor carpi radialis longus arises from lower one-third of lateral supracondylar ridge. Lateral intermuscular septum attaches to lateral supracondylar ridge.
Anterior border, In its upper part, it forms lateral lip of intertubercular sulcus. In its middle part, it forms anterior margin of deltoid tuberosity. In its lower part, it is smooth and rounded, and it ends above the radial fossa. Medial border. In its upper part, it forms medial lip of bicipital groove. In its lower part, it forms medial supracondylar ridge. Lateral border. In its upper part, it is indistinct. In its middle part, it is interrupted by spiral groove. In its lower part, it forms lateral supracondylar ridge.
Surfaces: anteromedial surface, anterolateral surface, and posterior surface. Anteromedial surface, it is present between anterior and medial borders. Anterolateral surface present between anterior and lateral borders. Posterior surface lies between medial and lateral borders. Between anterior and medial, anteromedial surface. Between anterior border and lateral border, anterolateral surface. Between medial and lateral borders, posterior surface.
Surfaces, three surfaces between anterior border and medial border, anteromedial surface between anterior border and lateral border, anterolateral surface between medial and lateral borders. There is posterior surface.
Anteromedial surface, upper part, it forms floor of intertubercular sulcus. It forms floor of bicipital groove. Middle part, it presents nutrient foramen.
Anteromedial surface, in its middle part, it presents nutrient foramen.
Nutrient foramen is directed downwards. Anterolateral surface, a little above the middle, it presents V-shaped deltoid tuberosity. A little above the middle, it presents V-shaped deltoid tuberosity. Deltoid inserts on the deltoid tuberosity.
Anterolateral surface, a little above the middle, it presents V-shaped deltoid tuberosity.
Posterior surface, it lies between medial and lateral borders. Upper part, it presents oblique ridge, which gives origin to lateral head of triceps. Middle part, it presents radial groove. Radial groove, it lies below and medial to oblique ridge. It lodges radial nerve and profunda brachii artery. Radial groove or spiral groove, it lodges radial nerve and profunda brachii artery. Posterior surface below the radial groove gives origin to medial head of triceps. Oblique ridge on the posterior surface gives origin to lateral head of triceps. Through the radial groove, radial nerve and profunda brachii artery passes. From the posterior surface below the radial groove, medial head of triceps arises.
Posterior surface, it lies between medial border and lateral border. It has spiral groove. Through spiral groove, radial nerve and profunda brachii artery passes.
Lower end of humerus, it is flattened antero-posteriorly. It is expanded from side to side. Features:
Lower end of the humerus has capitulum, trochlea, radial fossa, coronoid fossa, olecranon fossa, medial epicondyle, and lateral epicondyle.
capitulum, it is lateral, rounded projection. It articulates with head of radius. Trochlea, it is medial pulley-shaped projection. It articulates with trochlear notch of ulna.
Capitulum, it is lateral round projection which articulates with head of the radius. Trochlea, it is medial pulley-shaped projection which articulates with trochlear notch of ulna. Capitulum articulates with head of radius. Trochlea articulates with trochlear notch of the ulna.
Medial epicondyle, it is prominent elevation than the lateral epicondyle. Relations: ulnar nerve, attachments, common flexor origin. Medial epicondyle, it is more prominent than the lateral epicondyle. Relations: ulnar nerve. Ulnar nerve passes posterior to medial epicondyle. Superficial flexor muscles of forearm arises by common origin called common flexor origin. It is present on the anterior aspect of medial epicondyle. Lateral epicondyle, it is less prominent than medial epicondyle. Attachments: Common extensor origin and coneus. Lateral epicondyle is less prominent than the medial epicondyle. Attachments, common extensor origin and coneus. Common extensor origin. Superficial extensor muscles of forearm arises by common origin called common extensor origin. And coneus arises from posterior aspect of lateral epicondyle. Coronoid fossa. It is depression located anteriorly above the trochlea. It receives coronoid process of ulna during elbow flexion. Radial fossa. It is depression located anteriorly above the capitulum. It receives head of radius during elbow flexion. Olecranon fossa. It is depression located posteriorly above the trochlea. It receives olecranon process of ulna during extension of the elbow. Radial fossa and coronoid fossa are present anteriorly. Radial fossa lies above the capitulum. Coronoid fossa lies above the trochlea. Olecranon fossa, it is large depression present on the posterior aspect of lower end of the humerus. It lies above the trochlea. Anatomical position of the humerus. Head is directed medially, upwards and backwards. Head should be directed medially, upwards and backwards. A small prominent elevation, the lesser tubercle, should be placed anteriorly. Small prominent elevation, lesser tubercle, should be placed anteriorly. Medial epicondyle, which is more prominent, should be faced medially. Olecranon process should be faced downwards and posteriorly.
Anatomical position of the humerus. The humerus should be held in such a way that head is directed medially upwards and backwards. A small prominent elevation, lesser tubercle, should be placed anteriorly. Medial epicondyle, which is more prominent, should be placed medially. Olecranon process, it is directed downwards and posteriorly.